Hello, and thank you for joining us on the Stay Healthy San Diego podcast, brought to you by Parker Physio, aimed at helping you live an enjoyable, fit, and healthy life in and around our community. And now, introducing your host and author of Aging Smarter, Dr. Matt Parker.
Welcome, everyone. Super excited for our guest today. So she's an incredible lady, a good friend of mine. I'm going to read a little bit of her bio here. It is long because she's so awesome. She's a board-certified women's and men's pelvic health specialist. She's a certified orthopedic manual therapist of the spine. She's a certified strength and conditioning specialist. She's a member of the International Pelvic Pain Society. She's a member of the International Society for the Study of Women's Sexual Health. I have here Debbie Cohen, who is also the owner of Fundamental Physical Therapy and Pelvic Wellness here in Poway, California. And to top it all off, she's also the author of the Pelvic Floor Lowdown. Debbie, welcome. How are you doing today?
I'm fantastic, Matt. Thank you so much for having me on your show.
Yeah, so Debbie, it's been a long time coming. So we've been friends for a little over a year now, if I remember correctly. So when we first met, I think we got sushi with our friend Aaron, first time we met. So, but I want to go back before. I want to hear your story a little bit, Debbie. So tell me a little bit how, why PT? How'd you get started in healthcare, and kind of walk us through till today?
That's great. Okay, so going back, I'm a little bit of a later comer to PT. I wasn't a PT right out of the gate. I was actually a biostatistician before, so I have also...
Biostats, okay.
Right. I have a master's degree in statistics, and I started out working at MD Anderson Cancer Center in Houston, Texas. Okay. And because I was interested in healthcare and, of course, helping the world of healthcare. But I quickly found out that I like people better than computers.
Gotcha.
And that I really didn't like sitting at a desk most of the day. Cool. And, I've always been kind of analytical and numerically minded, and my family was all, scientists and engineers. So that's the background. But so I was looking for something different. And around that time, I met somebody who was a PT. Ironically, looking back, she was a pelvic health PT, but I never knew that I was going to go in that direction. So but she seemed kind of like me. Everything I learned about her and what she was doing felt like it fit. So I knew I wasn't going to stay in what I was doing forever. So I took a leap and went back to school. I was in my late 20s and became a PT.
So when you became a PT, did you know, early on, that you were going to transition into the pelvic floor? I'm curious, when did that happen, and how did you go from, physical therapy, where, it's a total knee replacement, and then now you're going into the pelvic floor, which is kind of a niche, kind of hidden gem is what I'd call it. So, where did that transition occur?
It happened somewhere during PT school. So entering PT school, I was interested in what most people kind of see on the surface of PT, which was pretty general orthopedics. I was really interested in body mechanics and how the body works and health in general, but I didn't know where I was going to specialize. And in PT school, I learned about all the different things that it can be and was interested a little bit in all of them. But then we had our 2 hours of lecture out of the entire 26 months on just what they called, air quotes here, women's health at the time. So we learned there's a little bit of this incontinence problem. Sometimes people leak when they sneeze, and there's a little bit of this pain with sex, and there are these muscles called the pelvic floor, and that's about it that we got. But I latched onto it immediately, and I talked to the instructor afterward, who ended up being somebody I worked for soon afterward, who was the director of the pelvic rehab program at the Women's Hospital of Texas in Houston. Fatima Hakim, she's well known in the women's health world. And just asked her, okay, how can I do this?
Gotcha.
She said, okay, just cool your jets a bit and keep in touch. Go, start with some good orthopedics, develop your smart hands, and keep in touch. And so a couple of years after I got out of school, that's what I'd been doing. And when she had an opening, I started working there and took off with the training and continuing education that it takes to start out becoming a pelvic health specialist PT.
Gotcha. And then you become this pelvic health specialist, and then when does it transition into your own business and your own, where did that spin from?
Sure. So that was a few steps along the way in the making. I worked at a few different places along the way. I started in Houston, Texas. I ended up moving to Anchorage, Alaska for a while,
Wow,
lived
okay.
there for a year and a half, made my way down to Southern California, starting with suburb of LA area, and then eventually, was getting, as many of us over time, getting more and more disenchanted with the way the healthcare system is going and the way that it's going for both the PTs and the patients of physical therapy who are looking to get better. And as I was learning more and improving my understanding and abilities in the pelvic health specialty, the system felt like it was choking off more and more the ability to do what I know how to do. And when it came to where I was having to see patients in 30 minutes for pelvic health, and it would be so frustrating by the time they come in and what I call download, tell their story for the day,
Gotcha.
and change and talk, the session's over. So I know what I can do, but sorry, I don't have time to do it for you. It was very frustrating for everyone involved.
Yeah.
So it was a matter of time and really giving the care and attention that's needed to solve the kind of problems that we're facing. And so when it came down to San Diego, I had the opportunity to work with and work in the office of a very well-known doctor of sexual medicine, Erwin Goldstein at San Diego Sexual Medicine here. So I was, while I was in the office there, I had already formed my business as a separate entity, in effect, renting space inside of his office, working with his group. And I was there for 4.5 years or so, and then about 2.5 years ago now, at the beginning of 2017, I ended up moving out of that office and into my own space, and that's when I started to take the business in a different direction, from mainly serving his clients to everyone that I can, doing it really in the way that I know that I can.
Well, that's where I want to transition there. So I loved your book. I want to kind of talk about that a little bit further, but I think it always helps to kind of start from the top. People might be listening right now and not know what the heck men or women's health is, what a pelvic floor is. Can you give us a quick, lowdown, no pun intended, of what's the pelvic floor? Sure.
Okay. So let's start with what are the problems mainly that people would come and see me for, and we know that will feed into what is the pelvic floor a little bit. So the kind of problems I help people with most often have to do with bladder control, pelvic pain, sexual problems, including pain with sex, some bowel problems, and so that's kind of the gist of it. So there's a lot of interaction between organs and the movement system in that area in the pelvis. You have a bladder, a rectum, women have a uterus too, and all that is sharing space with lots of muscles and nerves and joints and the movement system. So to kind of help interface all of that activity, you have in the very bottom of the pelvis a sling of muscles called the pelvic floor, where I can show you, and the listeners will have to imagine as best as possible.
She's holding a pelvic model right now, so
right?
I'm going to try and narrate a little bit. So
it's the pelvis, and you can see, orthopedically relevant structures of the spine and the hip joints, and all the pink stuff shown here is the pelvic floor. So this is a sling of muscle. People can see this model online too. Maybe you can link to a picture of it in your show notes.
Perfect.
Something like that. So it's a sling of muscle that in women has 3 holes going through it. In men has 2 holes going through it.
Gotcha. I'm holding the model right now.
So you can see similarities and differences. So basically it's a group of muscles that are filling in the bottom of the pelvis, and is also involved in controlling urinary and bowel and sexual function, but also involved in movement and responds in a lot of the ways that other aspects of the core muscles do with movement.
Well, let's talk a little bit about some of these problems that you do see. So the one I've had patients in the past that have had issues is with incontinence. So I have a lot of patients believe that incontinence is kind of like part of aging and part of getting old, but you're going to tell me different, right?
Correct. Yeah. So I'm really glad that you and most people these days or most people who end up contacting me, because they've realized that, sure, it's common, but not normal. And that's a popular phrase being thrown around now. It still, bears repeating that just because something is ubiquitous, you see it a lot, doesn't mean it's normal or that you have to put up with it. And for some people, the symptom itself, incontinence, is a symptom of something else going on. Sometimes the symptom itself is bothersome enough that that's what people want to deal with. And it should also be known that it's a sign of, other things that are not working right that could be worse down the road. But let's take it as a symptom.
Yeah. Well, are there different types of incontinence? Is it like I pee my pants, I don't pee my pants, I can go to the bathroom, I can't go to the bathroom? Can we dive a little further into that?
That's really important, because I was actually just recently at my own gynecologist appointment and paid attention that the questionnaire asked a whole bunch of just yes or no questions. The rapid fire, yes or no, do you have this, do you have that? Any incontinence of urine, yes or no? And I could imagine most of my clients who are seeing me because they're leaking urine would answer no to that, because there's a perception that incontinence means you can't control your urine at all, or something like that, which is not true. Let me define incontinence as any loss of urine involuntarily when you don't mean to. So whether that's bothersome enough to a person to want to change it is another story. But any loss of urine other than exactly when you mean to is incontinence. And there are different types too.
Okay. So I'm going to bring up just an experience of a friend of a friend. She's had a couple kids. She's very active, loves exercise. And I noticed that after vigorous exercise that she had urinated herself. And I, as a physical therapist, also know that this isn't normal. So can we talk to the audience a little bit about that? Like what's happening and like how, we go about fixing something like that?
Sure. So let's start out. That's one of the types of incontinence most likely. That's most likely stress incontinence, which is the more well-known version with, cough, sneeze, laugh, jump, any of those kinds of things where there's an increase in pressure in the belly and or pelvis, and that causes some urine to escape. So it's stress as in a pressure event, not as in I'm stressed out kind of incontinence. Good. That's important to clarify. So I'll get back to that. And the next most common one is called urge incontinence. That's where you have a strong urge to urinate, and it's so strong that the bladder just starts emptying itself before you get to the toilet.
Wow. Okay.
And a lot of women and men, by the way, who have either of these, who have urge incontinence, would say that, I don't leak when I laugh or jump. That's not a problem. It's when I get home and put the key in the door, my bladder knows we're home, and I have to throw down everything when I get in there and run to the bathroom, or it's just going to be, and the bladder might completely empty itself before you get there, not just a drop.
What if I drink less water? I feel like that's got to be a strategy that people try to use. No?
Interesting. Many people do try to use it, and is that a good idea? I would say it depends. Usually not, to the point where most people who are doing that are doing it. It's certainly not a solution. Restricting fluids isn't healthy, of course, if you're really restricting fluids. And B, when it comes to especially, this is an urgency problem. When you're restricting fluids, you make your urine more concentrated, and that in itself is irritating to the lining of the bladder. So it can be what triggers an urge event. Okay, so I tell people to look at the color of the urine, and if it's very yellow, it should be like light, almost barely colored.
Almost clear,
okay?
Right? Yeah.
Now, just to put that in there, some people do go too far to the other extreme, and I do see people coming in here and saying, well, I've been told to drink a lot of water. So once we document it, and I have them do a bladder diary for a couple of days, you might be drinking 150 ounces of water a day. And I say, no wonder you're peeing very often, and it's okay to cut back a little to maybe twice your body weight in ounces. Half your body weight in ounces.
Gotcha.
So just telling a person to drink more or drink less is not good enough. You have to know where you're starting. The same with kegels or anything else. If it were as simple as just saying, tell me the problem now, here's what you should do, I wouldn't need to be here.
Yeah.
And everybody would not be having this problem because they've read these things already.
So what you're telling me is Kegels aren't going to save my life, and that if I have urinary bladder issues, that doing a bunch of Kegels over and over again isn't going to be the end-all be-all for me.
Maybe. If that's worked for you already, God bless you. Okay? If not, if there's some man or woman listening to this who has already in their mind, done a lot of kegels already and it hasn't worked, there could be a number of problems, a number of reasons why. You have a symptom called incontinence or urgency, frequency, a lot of these overlap. And we need to find out, is there even a problem with the pelvic floor? If so, what is it? If it needs to be strengthened, what are you doing when you think you're doing an exercise for your pelvic floor? There was an interesting study a couple decades ago that for women, at least, in verbal instruction alone, if a woman was verbally instructed to do kegels, given a handout from the doctor, here, write it down, do your kegels, and then somebody would actually manually check what's going on, 2/3 of them are not doing what they think they're doing, and 1/3 of them are doing it in a way that would actually worsen the problem.
Wow.
So it's worse than not doing anything very often.
So it's not just reading a piece of paper and doing it. It's a little more complex than that.
Right. So what is the problem? How do you do it right? What is right? How do you progress it? Where do you need to start? What else do you need to do? It's about more than the pelvic floor. It's stress incontinence is a failure to manage changes in pressure. That's...
Speaking more about the pelvic floor a little bit, I know after childbirth in a lot of countries, they actually require you to go see a pelvic floor specialist. And I know in the United States, that's not required. I mean, what would be the purpose of having that afterwards, and where's the benefit, and why aren't we doing it in the United States, if you had a guess?
Yeah, there could be a lot of benefit to it. Certainly for some people, their bodies just recover from the trauma of childbirth naturally, no problem. For many, that doesn't happen that way. Vaginal childbirth is a big trauma to the pelvic floor, in some cases more than others. Even a C-section changes the mechanics of the abdominal wall. And as I said, everything is about more than just the pelvic floor. We can get into how the misconceptions about what a pelvic floor, quote unquote, physical therapist does. But in any case, whether it's vaginal or C-section, any other trauma or surgery very often entails rehab. And so, yes, in many other countries, as in many areas of healthcare, some other countries are doing it better than the U.S., and postpartum care is a big one. Why is it not required in the U.S.? I don't really know, but I think it's a matter, has something to do with insurance and billing, has something to do with cultural priorities around prevention versus treating problems after they crop up. But the good news is, I think that a change is a-coming, and times are changing, and there's, I think with all the information on the internet, there are a lot more younger moms now advocating for themselves, and I even have a lot of new moms contacting me with that same sentiment and question, saying, "Oh, I heard in France every new mom has this, so why don't we?" And I say, "Well, I don't really know, but let's see if I can help you if you'd like."
That's awesome. And then you don't just help women as well, you help men. So I'm curious on the guy side, what kind of men and what kind of things do you see and do you help, and what can pelvic floor do for a guy who, like myself, that may have some issues?
Yeah, sure. I'm happy to get to that. Can we stay on women for one more
Fire
moment?
Fire away.
If it's okay, it was probably the next hugest topic that I deal with women that I just want to be sure to touch on is sexual pain. So very, very common problem that is also not well addressed is pain with intercourse. We could go even beyond that, lots of pain in the pelvis problems, but a biggie, I think that would speak to a lot of listeners, might be pain with penetration. It could be with sexual intercourse, it could be with use of tampons, or with having a gynecologic exam, or any of the above. And all these are functional problems that do not need to be tolerated and shouldn't be. It's a common event for a woman to have a difficult or traumatic pelvic exam with a speculum, and then it doesn't get better, and intercourse becomes painful, or the practitioner may be telling her, just relax and you'll be fine. And if a woman, she can feel the tightness. If it were a matter of just telling a person to relax, she wouldn't still have this problem. It doesn't need to be dealt with and can have a lot of root causes, a lot of different causes. Again, it's a symptom that could have many things at its heart, different things driving it. And the the mystery of not knowing what's going on in the pelvic floor, it can make pain worse. We know a lot from the modern neuroscience of pain, how the more scary and mysterious something seems, the more likely it is to hurt more, simply because of the threat factor being higher.
So just because I believe it's going to be more painful, that's more than likely a chance it's actually going to be more pain. I'm going to have that sensation more so of pain.
That's possible, especially also not knowing what it means. The idea that wow, when it hurts so much and the doctor looks at it and says everything looks fine, you shouldn't be having pain because everything looks fine, then the sense that, wow, it must be something really bad because they can't even see it, and who knows, it's such a black box in there, I might have cancer, I might have who knows what, because people don't know what could be going on in there, and that makes it possibly can contribute, is one of the things that can contribute to things hurting more, is just not knowing what it means, and not being taken seriously, not being given the time and the care that, yes, the pain is real, it's not in your head, it's not something you should put up with, and is worth dealing with. It's not something that is okay to put up with if you don't want to, and it's treatable. It is treatable. Yeah. So, just knowing
that's the most powerful part.
Right.
Yeah, so that's something that can be done about it, and it doesn't have to be this black hidden box and this big scary thing. So that's
we're
incredible.
knowing there's a solution. Hopefully will be the motivation to find it, get help.
Understood. Well, I'm glad we touched on that topic. I'm curious on the guy side too, because I know you do treat men as well, and I'd love to know more about what kind of men do you help and treat.
Absolutely. So yeah, I'd say at any given time about half of my clientele is men and half are women. So just as many troubles on both sides possible. We all have a pelvic floor and all have a variety of things that can go wrong there. So probably the most common scenario for a man that I see would be kind of a youngish, there are different points in the lifespan, in the 30s, maybe then later in the 50s. Kind of those two groups are the most common, but it can be across the lifespan. And it'll be somebody who's had symptoms of take your pick across this menu of symptoms.
Okay.
Urinary frequency, pain with urination, difficulty urinating, pain in sitting. This is pain in the bottom, somewhere in the bottom, in the perineum, in the penis, and the testicles, and the anus, feeling like sitting on a golf ball. Right. And these can be with sitting. It can be during or after sexual activity, during or after certain physical activities, running, weightlifting, things that involve a lot of exertion in the hip area especially. Interesting. So that's the typical profile, and they probably would have been to a urologist, maybe a number of times, maybe been told they have prostatitis, maybe had a prostate exam where the doctor said, well, it feels normal, but maybe there's an infection that you should take some antibiotics, which may have helped temporarily because antibiotics also have an anti-inflammatory effect. And this is somebody who made it to me. I mean, maybe it was an infection and antibiotics took care of it, and that was it. But the ones for whom that doesn't help may have been on several courses of antibiotics already and finally found out maybe there's something different going on here, and somehow either had a savvy enough doctor that they were referred to me, or they found themselves online by Googling their own symptoms. So that's how people come to me, and we often find out then that it actually was a pelvic floor muscle spasm or tension problem or nerve irritation in the pelvis, and we help it that way.
So you help a lot of different things, and I love learning about this kind of stuff, and I hope it's been helpful for the viewers as well. I have another note I wrote down here about painful bladder. So I know I've had some dad's friends complain about the painful bladder. Can you explain a little bit more about that, why you may have a painful bladder and what that's all about?
Yeah, that's a really good one. So I would put that in sort of the group of pelvic pain syndromes or symptoms that either men or women can have. It's usually coupled with urgency and frequency, the feeling of needing to pee very often. Sometimes the bladder there's pain in the bladder and it's relieved only by emptying the bladder. Okay. Sometimes it's painful as soon as the bladder's starting to fill and it just needs to be emptied, and a person can be going every 15 minutes just to relieve this feeling. They can be getting up 10 times at night. Sometimes it's worst at night, or it's only present at night. And they may have been told that they have IC, interstitial cystitis, which is a loosely defined syndrome of sensitivity of the bladder lining, which is now being called more painful bladder syndrome.
Okay. Gotcha.
And is very correlated with pelvic floor muscle tension. And, it can get into a lot of the basis of this, how muscle tension can actually change upstream the tissue lining in the bladder through reverse nerve effects. But basically, there are all kinds of things that can affect this. Diet, medicines, physical activity, all the things that can affect any other kind of usually very persistent, long-standing pain syndromes that can go on a long time. But it's almost always correlated with pelvic floor muscle tension, spasms, and painful little points in the pelvic floor muscles, and that can be dealt with manually and with muscle training and addressing whatever the driver of it is, which often has another orthopedic origin in the spine or the hips too.
Understood.
Yeah.
Understood. So I got to imagine, Debbie, with all these kind of different diagnoses and not know what's going on, and I would be pretty terrified on my end. Like, is that something you see commonly, like people that are like nervous and like, talking to you and opening up, like, when you have these kinds of things that are kind of private, personal matters, painful sex, painful bladders, going to the restroom, people like wearing diapers and not wanting to wear diapers, like, is that something that's common in the pelvic floor community?
Yeah, I would say among the patients that I see, the most common fear or worry is just not knowing what the heck is going on, and not having been taken seriously enough by practitioners they've dealt with so far, that this is a real problem and that there's a real solution, to have somebody listen to them and say, yes, I've seen this before, it's actually what I see all the time, and I know how to help you. There's the big sigh of relief, which is my favorite moment. And we move forward from there. So yes, I think compared with, it's just a different world compared with if it's just, I'm saying air quotes, knee pain or shoulder pain. It's a little less personal and to your very being than a pelvic pain or urinary problem that you don't understand. So yes, there's a lot of fear, anxiety, frustration, disappointment, anger at the medical system.
Understood.
That is part of the whole ball of wax that we're dealing with, in addition to whatever the physical problem is. And I take all of it into account because it's all relevant for getting a person better and getting them to the life they want to live.
That's incredible. I gotta ask again, just because I like these questions here. Does pelvic PT hurt?
Oh,
hopefully that's not a dumb question, but
the best question. Thanks for that.
Yeah.
That's a big barrier that holds a lot of people back from coming in. Is that, hey, I have here. Take for example, a woman with pain with vaginal penetration, and they read a little bit about what might happen in a pelvic PT visit, and say, oh, they're going to want to examine my pelvic floor muscles from inside, and someone's going to put a finger inside my vagina and push on the muscles. That sounds terrible. How's that going to work? So the good thing is that with communication and with my training and experience, I don't want to hurt anybody. I am not going to hurt a person. I'm going to examine and test to find out where the places of issue are, and then the treatment is not to be painful. And a lot of times understanding what's going on and what a sensation means immediately takes down the pain quite a bit. Now, that of course depends what's going on, but if what a person has to reference is a gynecologic exam, or for a man, a urologic exam, oh my gosh, do I have trauma stories of men being examined by their urologist? It's a very, very different scenario. The amount of time that I have and the way that I communicate with a person, and that the exam and treatment are a learning experience for the person as much more than me doing something to a person. So no, it is not supposed to hurt. Anything that does hurt would change or stop right away. And I have my number one rule in here is, you're the boss. Anything that is not okay for any reason, we just stop right away. And that's very important because a lot of people have some kind of sexual trauma in their past too. So that's the most important thing to address first.
And first off, I love the fact how detailed you are and how you spend the time, and you understand that people may have been thrown around by the medical model a little bit. I mean, do you have couples come in here as well sometimes, or does that make people more comfortable? Is that something that's an option for, in the pelvic floor community and with yourself? If I had a girlfriend or wife that I wanted to bring, is that acceptable, or is that?
Absolutely, and it's encouraged. If a person has anybody, even a friend, family member, partner, a loved one, is very encouraged to have an extra set of eyes and ears, and for the moral support or chaperone, whatever it is they want to call it. Yes, so people are encouraged to bring somebody along.
Gotcha. Debbie, are there any misconceptions about pelvic floor physical therapy that we should know about?
Yes, a pelvic floor PT is pegged as the kind of PT that helps people with bladder problems, pelvic pain. Now I get a lot of people calling and saying, well, can you still help me if I also have this back problem or hip problem? Or do you also treat back problems and hip problems, or are you just working with the pelvic floor? So I'm trying to find the best way to say this, but what's important is that these problems are two sides of the same coin. Okay. It's very common, I'd say most of the time, somebody who comes knocking on my door because I'm the pelvic floor PT really has most commonly a back or hip problem that needs to be dealt with in order to solve the quote-unquote pelvic floor problem. So I try not to peg what I'm doing as pelvic floor PT. I tell people, okay, if you have a problem, if your concern is primarily in the pelvis, urinary problem, these kind of symptoms, that yes, I'm the best person to help you. I have the training to be able to deal with the pelvic floor part of it. If your main concern is back pain or hip pain, then you have a lot of choices, and some are much better than others, of course, who to help you with that. And if you happen to also have bladder symptoms with that, you might want somebody who can deal with the whole package, including the pelvic floor at the same time. Okay. So that's kind of how to know. I'm working with a woman now who just had a hip replacement 3 months ago, was not prescribed any rehab, so is really having a hard time, still in a lot of pain, but also had incontinence before, which has gotten much worse since her hip replacement. And now the urgency and the urge incontinence part is getting worse because she can't walk to the bathroom when she needs to, and is slow, and then the anxiety builds. I'm not going to get to the bathroom. The fear kicks in, and that's going to trigger the bladder more quickly, for example. So that's how I think it's important not to pigeonhole or separate the worlds of pelvic floor, quote-unquote, PT from the orthopedics of what else is contributing to this problem. So I definitely deal with all of it and look at the whole package and the whole body.
Understood. So it's not just one corner, it's a whole lot of things happening at once. So wow, pelvic floor PT, you treat a lot of things. Again, we talked about the bladder today, we talked about incontinence, we talked about childbirth and kegels and all kinds of great information. Where can people find out more about you, Debbie?
Sure. They can find out more about me primarily on my website on pelvicwellnesspt.com.
It'll be in the notes as well, everyone listening. So we can find your book at your website at pelvicwellnesspt.com. You have a lot of wonderful information on there. I absolutely love your website, by the way. But I want to transition a little bit to some more fun stuff here. Because we are a San Diego locally based podcast, I want to know more your favorite activity to do in San Diego.
Oh boy, so I'm an active person, not extremely athletic by any means, but I love being active. So, I love the usual hiking around the beauty of San Diego. Maybe a little less common thing that I love to do is Israeli folk dancing.
Yes, so I want to talk about. Listen, I prompted that question, Alex. So Debbie invited me once to Israeli dancing. And can you describe it a little bit more? I'm not going to do a good job describing it. I'll tell the story, but what exactly what does it consist of? What's it look like?
Yeah, so it's a big group of people. It happens on any big city in the world. And it's a big group of people get together and do these dances, which is that every song has its own choreographed dance that you learn. Israeli music from all different eras, and you learn these dances. It's fun. They're easy in terms of not too many different complicated steps, but it's great fun for your body and great exercise for your mind to memorize and learn to put these things together. And we have a fabulous teacher here in San Diego. Yoni Carr is just a treasure of San Diego, who I plan to take full advantage of as long as she's still doing her thing. Mm-hmm. And it's great to see you there. And I've gotten a couple of my clients I recommend to come from time to time as part of a transition back to being active and doing something fun for their mind.
Yeah, I mean, what she said there is everything is choreographed. So I went when everyone was already pre-choreographed and not knowing stuff. It was I would describe myself as 2 left feet. I mean, Debbie probably doesn't feel the same, but I struggled a little bit, but I had a great time. It was a blast. Everyone is super friendly there. If you guys get a chance, you should absolutely do it. Before I let you go, Debbie, one more question. San Diego based, favorite restaurant or hidden gem?
Well, I'm a fan of Mediterranean food too. Hummus being one of my favorite foods. So
me some. You said hummus?
Yes, hummus. Oh. That's the right way to say it.
So I can't say hummus. Okay, hummus.
Well, if you want the Hebrew flair to it.
Gotcha.
And on.
Where do you go?
I think it's on Claremont Mesa. It's called Aladdin. Yeah, near Claremont Mesa. I think near the 805 Aladdin. I think that has the best hummus in town.
So go to Aladdin. Go get the hummus. And then spicy hummus, regular hummus, what's your jam?
Hummus shawarma. So you get with chicken shawarma on it. And you dip the pita in it. And you have some salad on the side.
Awesome. Debbie, anything else you want to leave for our audience before we go today?
I just want to say, hopefully this book that I've written will provide information to people who just want to know more in order to find out whether the problem they have is something that can be addressed. So feel free to pick up the Pelvic Floor Lowdown, an expert physical therapist's guide for women on getting control of your bladder, relieving pain, and living the life you love.
It's available on Amazon, and it'll also be in the show links as well. So thanks for being here today, Debbie. Take care.
Thank you for listening to the Stay Healthy San Diego podcast brought to you by Parker Physio. If your pain is preventing you from staying healthy and active, and you'd like to avoid surgery, painkillers, or just want to get back to doing the things you love in and around San Diego, we offer both a free ebook and free over-the-phone consultation to help you figure out the root cause of your pain and the next best steps for resolving it. Find our ebooks online at parkerphysio.com/health-tips. There you'll find ebooks for topics such as low back pain, sciatica, shoulder pain, knee pain, and neck pain. These quick-to-read reports will provide you with expert tips, tricks, and exercises to help solve your pain from the comfort of your own home. Just visit parkerphysio.com/health-tips to download your ebook and have it delivered directly to your inbox. We also offer free, no-obligation telephone consultations with a doctor of physical therapy to residents of San Diego. Just call us at 858-900-3361 or visit us at parkerphysio.com and click the Talk to a PT on the Phone button. Thanks again for joining us, and we'll see you next time on the Stay Healthy San Diego podcast.